When you hear the words, it's cancer, and it's in reference to yourself, it comes as a shock, and it certainly was to us. He was only 61 years old, had lived, been very healthy, had good eating habits, was active physically, and never saw himself as being ill. His parents had both lived to be 92 years old, and that was the scenario he saw for himself. But then came that day that he had the diagnosis, and within 2 days of his diagnosis, he had surgery for that colon cancer. And then he had a number of years that he had chemotherapy and radiation for a good number of those years and months. So he had access to the best medical care that this city and state can afford, and I really think in the nation. But during that time, he had a patient that came to him that was about his age. She too had been diagnosed with colon cancer, as had he. Her scenario was much different because she didn't have health insurance. She was too young for Medicare. Her family was of modest means. She had come to her physician, my husband, after she had had symptoms for quite a while because she knew that she didn't have health insurance and couldn't pay a physician. Someone had referred her to come to my husband because she would be able to get care at a lower fee or without paying. So it was sad for him to realize that this woman's treatment, a cancer, had gone untreated from financial reasons. Then when she found out what her diagnosis, and it too was advanced, as had been my husband's, she opted not to pursue further care because she didn't want to amass large financial bills that she would never be able to pay or that would be a burden to her family. She died within a couple of years after she had come to my husband. And it was such a poignant reminder to him of what's accessible for the people that have insurance or money, but what is not accessible for people that don't have health insurance or don't have money.
About 22% of our population, our entire population here in Oklahoma, that is uninsured. That's an unacceptable number.
So we rate fourth in the nation in the number of uninsured people at any given time in the state. So that's one of the reasons that we have so much problem and so much our costs for health care are even skyrocketing, because those people will get sick. Those people will have to be cared for.
All of us as consumers end up paying that bill. It's the old adage, it's the old cost shift, which still does exist. It's an economic reality. If you see a healthcare provider and you're not able to pay, then that healthcare provider spreads that cost of your care to all of his or her other patients.